this morning, the U.S. healthcare system, there's a new report out this morning that shows the U.S. healthcare system has ranked last among the 11 wealthiest countries, despite, by the way, spending the highest percentage of its gross domestic product on healthcare. So this new analysis,
Isn't that crazy?
Yeah,
We're
we spend
first
more.
in killing and last in helping.
We're the best at killing. We absolutely crush it at killing and bombing other countries. Here's the new report by the Commonwealth Fund. Stunning new report ranks U.S. dead last in healthcare among richest countries in the world. Researchers behind the report surveyed tens of thousands of patients and doctors in each country and used the data from the Organization for Economic Cooperation and Development and the World Health Organization. And the report considered a number of key data points here. 71 performance measures. So let's scroll down here. 71 performance measures under 5 different categories. And guess who was number 1?
New Zealand? Norway.
Norway. Netherlands and Australia were the top performing countries overall, with the U.S. coming in dead last. Surprised by that? Is anyone else surprised by that? So I get so freaking frustrated and angry, like I want to punch a computer screen or something. And you know me, I don't get mad, right? I'm not like a fiery kind of person, but it infuriates me when I hear people who are totally ignorant telling me that the U.S. has the best healthcare system. What do you want to go live in, like Norway? Have like a socialized medicine? The answer is yes. Because the care process, the administrative efficiency, the equity, the overall healthcare, all of it. I mean, access to care, number 1 was in one of the categories. The care process, the administrative efficiency of the process, equity in healthcare outcomes overall. So yes, the U.S. ranked last in care. It ranked last in administrative efficiency. It ranked last in equity in healthcare outcomes. Despite
but you know
the
where
fact,
it probably ranked first? Profit.
Oh, yeah, of course. Well, we can charge 10 times more for pharmaceuticals in the United States. We can charge, you need a Tylenol? Like my wife, when she was pregnant, we were delivering Miles, our first baby. Like she couldn't believe like the itemization, like getting a Tylenol was like, I think it was like $100. It was something ridiculous on the bill.
You know what I'd be curious to know? I'd be curious to know how much Pfizer is charging the United States for the vaccine versus like Israel and other countries. Like what are other countries paying for the vaccine versus what we're paying here in this country? I would love to know that.
Yeah, that's a good question. Well, and the fact that you have all these, I just still can't get over the fact that you have these, you have these countries like China, you have other areas right now that didn't have access to like the U.S. funded, by the way, billions that were funded to these pharmaceutical companies to make the vaccines, right? And we can't give access to help the rest of the world because guess what? So goes the way the rest of the world goes, so goes the U.S. This is a astounding piece of this. Half of lower income U.S. adults in their report said costs prevented them from receiving care, while just more than a quarter of high income Americans said the same. In comparison, just 12% of lower income residents in the UK and only 7% with higher income said it cost them stopping from getting care. The U.S. also has the highest infant mortality rate and the lowest life expectancy at age 60 compared with other countries. Researchers said several key factors set the high-performing nations apart from the United States. So here are the big differentiators. Guess what? They have universal coverage. Let me zoom in on that. They're covered. Everyone. They have universal health care. They also remove cost barriers. So they don't pay through the nose. They can they can have a baby and deliver a baby and not pay $5,000. It's free.
How much does it cost if like a senator or a congressperson has a baby, I wonder?
Oh, it's free.
Oh, it's free? Oh.
That's free. But David, that's socialized medicine. And we do not want to become a socialized country, right?
Oh, only for corporations and our Congress and Senate people. I got it.
Joseph said, I'm glad Clayton's not bad-mouthing Marjorie Taylor Greene today. Why? I called her hypocrisy out yesterday, Joseph.
That person probably likes corporate communism.
Right. And by the way, I was giving the news. She was spouting total BS about a company in her district that was run out of her district because of a big corporation.
I guess the truth makes Joseph uncomfortable.
That's what we do here. You want to get uncomfortable? That's what our show's all about. So if you were uncomfortable about Marjorie Taylor Greene, then you're in the right place. So in the removal of cost barriers. Yeah. So how much does it cost? Investment in care systems to reduce inequities. Oh, wow. You mean, so if you're a lower income citizen in Norway, like it doesn't matter? Well, how shocking is that? Imagine that. Oh, and we have investing in social services for children and working age adults as well. And by the way, we should even mention, elder care. What do you mean? So children and early childhood development and all of that are taken care of for these families in Australia, in France, in Germany, the Netherlands, the list goes on. New Zealand, Norway, Sweden, Switzerland, the United Kingdom, and the United States is freaking dead last. Sorry.
Well, that's the thing. Like, why does American exceptionalism only apply to war? Why are these people just like hardcore American patriots when it comes to war and our position in the world and our military might? But when it comes to taking care of our people and helping people, well, that's socialism.
Yeah, I mean, it's a great question. And the propaganda, I think the reason, and we're going to talk about some of the propaganda here on the show in just a minute when we get to our story here about coming up, actually, reporters and their ties to the Pentagon. But it's all a propaganda machine for big business, right? So you've been lied to. When you watch mainstream media, you've been lied to. We've seen for years, I've seen talking heads across networks like, look, America, yeah, we're not perfect, but you don't want to wind up like Norway, do you? And all the talking heads will chuckle. I want to be like Norway. What are their taxes, like 43%? I don't exactly know what their tax rate is, but yes, they pay more in taxes. But guess what? Everyone's taken care of. They also don't bomb other countries into oblivion, and that's how they save money. They don't have to bomb the rest of the world on a regular basis.
Did you watch the documentary Sicko, Michael Moore, where he broke down basically like what they pay in taxes over there versus what we pay in hidden, like what we don't even count as taxes here? It ends up being around 70% for us anyway. If you look at what we actually spend on taxes, federal tax, state, all that stuff. It's
all propaganda. That's what my point is. Like we're so lied to, and we've been fed this narrative by the mainstream media, which is in total cahoots with Wall Street. Remember, mainstream media is run by billionaires. They make their money by keeping you in this cycle of poverty. They make their money by you being beholden to the system. I mean, what other country do you flip on the news in the afternoon or just put on the news at like 1 p.m., flip on like, I don't know, CNBC or some other channel in the afternoon, and all of the drug commercials that are being broadcast to you back to back to back. There's all kinds of insurance commercials. There's all kinds of drug commercials. It's a whole system built on lying to you and getting you to spend money on it. Reverse mortgages so that you can pay off debts. I mean, come on.
And I remember that video you played of interviewing people in the UK when they were talking about prices of what we pay for things over here. Yeah. They're advertising on TV, spending millions of dollars a year on pharmaceuticals, and then you go and we're charged outrageous prices for them in the United States to cover those marketing budgets, and then overseas in the UK they're paying like not even a quarter of what we're paying.
Right. Well, we don't want to wind up like them, though, David. We certainly don't want to. Better quality of life, longer life expectancy, healthcare, a great education system, better food, vacations, and it's a free market. It's a market-based economy. It's not socialism. Now, it should be clear: there's never in the history of the world been a socialist country in its purest form. Never. It's never existed. There've been shades of it here and there and pieces of it. But when you work towards the common good and you don't have massive income inequality and this huge wealth gap in other countries. So these CEOs in other countries, in Norway and Netherlands, like they live a great life, but they don't make 33 times what their cheapest or least employee makes. We do in the United States. Well, my favorite part of this at the end here is if healthcare in the United States were an Olympic sport, the U.S. might not even qualify in a competition with other high-income nations, Eric Schneider said, the lead author behind the report. The U.S. has two healthcare systems. For Americans with the means and insurance to have a regular doctor and reported experiences with their day-to-day care are relatively good. But for those who lack access, the consequences are stark. The performance is nothing new. The U.S. has landed in last place in all 7 studies the Commonwealth has funded since its release in 2004. So this is nothing new. We've been talking about it here on the show. It was awful under the Obama years. It was awful under the Trump years. And it's awful under the 6 months of the Biden presidency. Nothing has changed because all of these corporatists run Washington. They run the presidency. They run Congress. We should not be surprised by this.
But we knew that. He said nothing will fundamentally change. I mean, he's living up to his word.
Yeah, and that's a reason why Bernie Sanders doesn't get elected, because the corporatists will not allow that to happen. The Democratic Party, as you know, fought to get him off the ballot and fought long and hard to make sure that he wasn't winning. And we know that. We know that during the Hillary run when Bernie Sanders was running against Hillary. We know that from the DNC emails. The only reason we know that is because of Julian Assange, by the way, who I guess is a traitor. Anyway, right. That's our healthcare. I want to talk about the MyPillow guy. You're going to wait till you see this video that actual journalism against the MyPillow guy. He gets debunked. We're going to show you that. And we're going to also look, coming up here on the show, how reporters really love the Pentagon. And some really new troubling reports about major reporters at major newspapers that probably many of you read on a regular basis, and I hope that you don't, but you probably do. They're in cahoots with the Pentagon, which is a total shock, I'm sure. Thanks for subscribing to the channel. You can also become a channel member by going to morninginvest.com/join, where you can stick it to the mainstream media and support independent journalism. We're able to bring you the stories that you won't see on any of the major billionaire-backed networks. Thanks so much. We'll see you next time, everyone.